have Dr. Liebers leading the team that is caring for COVID patients and educating our community about the pandemic. We are going to do a short Q&A on COVID-19 with Dr. Liebers, and then we will open up to the audience and allow you to ask your questions. All right, let's get into the questions. So, Dr. Liebers, can you give us an update on COVID-19? What do the numbers look like locally and at Ellis? Oh, you're muted.
How about now?
Perfect. Good to go.
Good, Phil. Okay, so I think this falls into the education category, not the fun or the shopping, I'm afraid.
Yeah,
so,
well, be a little bit of fun.
Yeah, hopefully it'll be fun. So I think it's important to think about the national picture, and as we know, COVID is now widespread in the United States. Unlike early in the pandemic where it was focused in certain areas, COVID is increasing pretty much everywhere, and that really includes New York State and the capital region. We heard this morning as a group of regional healthcare leaders get together every day to talk about, or every Wednesday, I should say, to talk about COVID, that our inpatients are up by about 20 compared to last week. And we see a gradual rise in hospitalizations throughout. So we're seeing an increase. Some good news is we're seeing fewer critically ill patients, even among those who are hospitalized. And I think that may reflect a number of things, but perhaps that we kind of know how to protocolize the treatment for the COVID patients at this point.
Okay, so there's been a lot of talk regarding a vaccine. Will you share with us what you know and if there's a timeline?
Well, there's a lot of vaccines in production. There's 6 or 7 that we are particularly interested in here. I'm going to really parrot what Dr. Fauci has told us, and we may have a vaccine that is graded as safe and effective by the end of this year and be distributed perhaps, I would say, spring and summer of next year as a conservative estimate, though I think we're cautiously optimistic that at least we'll have one vaccine, maybe more, for next year.
Okay. So the holidays are coming up and people are ready to get back with their families. So what recommendations and strategies would you give to our attendees on the best way to celebrate?
I think we want to keep things small. I think we want to try to stay in our bubble, and I think we've all established bubbles of people who we encounter frequently. It should be a small group. Obviously, it's unlikely outdoor celebrations will be possible for Thanksgiving or Christmas, but we've had some pretty warm ones in the last couple of decades. But I do think keeping the principle that we really want to avoid crowded indoor spaces is key. Density is an issue. You really want to be able to space out, and numbers of folks we encounter is an issue as well. So again, small groups, maybe more of the nuclear family than the extended family, utilize things like Zoom to create a bigger celebration, and maybe some outdoor stuff. We thought we might have at our house, open up the garage and let some people stop by and pick up a dessert on Thanksgiving, as opposed to bringing everyone in as we usually do. We have 30 people in our house and Thanksgiving usually. It's not going to happen this year.
Yeah, that's a great tip. So we hear a lot in the news about a second wave. What does that look like for the capital region? Also, what should we expect in the next upcoming months?
Right. So if you look at hospitalizations nationally, there was a first wave early on. There was a second wave in the summertime, and then another fall off in hospitalizations. So there does appear to be nationally a third wave. I think due to the way we've handled things here in New York State, our hospitalizations peaked in April and have stayed pretty steady. However, we are seeing an upslope in hospitalizations. I think it's very hard for us to predict where that peak is going to be. What we do as a community, much more so than what we do as healthcare systems, is going to determine, I think, how big that wave is. Are we going to be able to maintain our resilience, combat the COVID fatigue, and continue masking when out and about, continue the social distancing, maintain a less dense existence with others, hand hygiene, and the basic premises that we've emphasized all year, essentially. I'm sure the rate is going to go up. What the peak looks like, I think, is sort of up to us as a community. How well are we going to stay the course? In a sense, take a deep breath and keep going.
Gotcha. Okay. Well, I know that
And
the
I
question
see
everyone-
Dr. Dibble there. She's a distance runner. This is a distance run. This is not a sprint. And, you know, we're not, I'm not sure what mile we're at, Colleen, but it's less than 20, that's for sure, in terms of a marathon.
Gotcha. So I know that the question everyone really wants to ask is when will this end? But I'll turn it over to the audience to see what questions they have for the experts. We'll spend about 5 minutes.
Yeah.
So let's see what we have here.
Well, ending, I think, does, in a sense, a safe and effective vaccine will accelerate us to the end. So I think we're all very anxious to see what vaccine is released, how many, and when it'll be available.
So, okay, our first question here is, I'd love to take my kids trick-or-treating on Saturday. Is it safe?
Well, safe is always a relative term, but I think it can be safe. Actually, there's a big CDC website instructions that basically says the following. Ideally, as a treater, you would wear a mask. You'd stay 6 feet away from the trickers. Keep bags of candy out there so they can pick them up and take them. Wash your hands frequently. For those taking children out, the mask, the cloth mask, should be part of the costume. That should be part of the costume. Do not put a cloth mask on anyone 2 years old or younger, and maybe they shouldn't be out, frankly. And mask the children. Everything should take place outdoors, and you should maintain a low density environment even as you're either driving around or walking around. So outdoors, masking for those giving out the treats, cloth masks for the kids coming out and picking up the treats, and preferably leaving bags of treats that you can direct the children to take. You might have to watch that carefully in that I know that sometimes people take more than their allotment, but right. I think to try to maintain that distance is very important. So I think it can be safe.
Okay, our next one. What is the risk of getting on an airplane?
Well, I think the risk of getting on an airplane right now is higher than many situations. I don't think it can be quantitated, but you think of the environment in an airplane, folks are packed in, there is air circulation, but it's a dense environment. So you've got a dense environment, and I think the risk is higher than many other things that we're doing. I would not advise air travel unless it's necessary.
Okay, so.
And again, I think we think of it in the current situation where the number of cases is increasing pretty much every day within the country. So this may be even a higher risk time than it was back in August or September. Because there was a time even at Ellis where we had no cases in the hospital in August.
Yeah. So this is the next one. For people with kids in school learning, what are your thoughts? They're carriers of it without showing symptoms, and if this is possible, the safety precautions when it comes to seeing their older relatives.
Well, I think I'll start with the older relative one. I think that certainly is a risk because many times children will not exhibit symptoms. Probably the good news is if you're not exhibiting symptoms, you're probably less infectious than you are if you are. Nevertheless, spreading can occur without symptoms at all, whether it's before symptoms appear or if symptoms never appear. Same issue, I think, cloth masks and distancing. We like to use that 6 foot distance. I think the 6 foot distance is quite appropriate in fairly spacious areas. Riskier if you're packed together in a small room We do think there is some aerosol spread of COVID-19. It's certainly not as common as that droplet spread, which is that 6-foot spread that doesn't hang in the air. There may be situations in very closed areas with poor ventilation that it's even riskier. So you might want to encounter those relatives in a spacious area, on the back porch, on the front porch, in a big room. But mask and 6 feet. And try to keep it in the bubble. You know, if it's an older relative group, keep it small so we're not introducing new opportunities for transmission all the time by bringing new faces and new people coming from different, essentially, transmission backgrounds, if you will.
Makes sense. So, I've seen reports that blood type affects the severity of COVID symptoms. Do you have any knowledge on this?
Yeah, there's some evidence that outcomes have not been as good in people with blood type A and better with blood type O. It's not a huge relative risk. Okay. So as a blood type A myself, I don't stay up night worrying about that.
One other question is, what's the accuracy of the saliva test versus the nasal swab?
Well, I think we're talking about PCRs. I don't know that much about the saliva test, but the most accurate test is the PCR test done by NP swab. Saliva may be very accurate, though. We're not utilizing that locally, at least not in the healthcare systems.
Okay. Well, if anybody else has any final questions, fortunately, that's about all the time we have with Dr. Liebers. But thank you again for joining us and sharing your wealth of knowledge. I think I speak on behalf of everyone to say how helpful this information was today. So we appreciate your time. Well, I wish I could spend a longer time actually speaking to you from Albany Medical Center this morning, where I'm participating in a press conference. So they're going to be coming to get me any minute, though. But it was a pleasure to chat with everybody. And mask, distancing, watch the density. We got to keep it up. Right. Well, so switching gears, our health panel is here with us, and they've come up with 3 different profiles of women who are facing different challenges due to the COVID-19 pandemic. Our distinguished panelists will review each woman's scenario and discuss tips and strategies for their situations. I am so happy to be joined here today with Dr. Colleen Dibble, is a board certified in internal medicine and a beloved and skilled physician with Ellis Medicine's primary care team. Next is Mary May, a licensed clinical social worker and the clinical manager of Ellis Medicine's outpatient mental health facilities. She leads the team of clinicians who counsel and provide much needed therapy to our community. And last but certainly not least, Dr. Sonali Patel, in addition to being this year's 2020 Janie Award recipient, Dr. Patel is board certified in family medicine and a hospitalist at Ellis Medicine, where she cares for patients regularly. So thank you all for joining us today. Let's dive right into the profiles. And once we get through all of them, we'll take questions from the audience. So our first profile here is Julie. At the age of 37, Julie has her hands full. She has 2 kids and a husband and an 8-year-old daughter and a 6-year-old son. She and her husband are both professionals and put in 40 hours plus a week. But due to the COVID-19 pandemic, Julie is now working remote. However, John must report to the office. In addition, both of the kids are attending school virtually. Julie is balancing her time during the day between meeting her work deadlines and ensuring her kids are participating in virtual learning. She struggles daily and is often resentful of John when he comes home, which has led them to arguing on a more regular basis. With all Julie has going on, she's noticed that she's gained weight. She tries to stay active, but with the gym closed and the stress and anxiety, she doesn't know what to do to keep herself sane. So Mary, why don't we start with you? What jumps out to you?
A lot jumps out to me. I feel anxious just even reading this scenario. So she's in a very typical situation where she's juggling her career and childcare. And this has always been a problem for working women, even before COVID. But the first thing I would do to try to help this woman is there's a couple of things. I first want to work on her with how to reduce her stress, her physical stress. And then secondly, I'd want to talk with her about supporting her children's emotional and social functioning during COVID. And lastly, how she can seek more support. So the first thing is, her life feels really out of control right now. So there are conscious efforts that she can make to feel more in control. And one of the most effective ways of lowering stress is deep breathing. And this is because you can do it anywhere. You can do it while you're driving in the car, while you're in a meeting. It just takes a few minutes. And what you need to do with this is put your hand, one hand on your belly and one hand up on your chest, and take a deep breath. And you'll notice that most people feel the breath up here in the chest. You should be breathing from the belly. And there are apps on the internet that you can access that will show you how to breathe in a rhythmic fashion, where you count on the count of 5, you take a deep breath and then release it on the count of 5. And you'll automatically, if you do this for just a few minutes, you'll notice that your stress level goes down, your heart rate will go down, your blood pressure lowers. It's really effective. So aside from deep breathing, another practice which is really important is mindfulness. And I'm sure many of you in the audience have heard about this. Mindfulness, there's many ways to practice it, but it's essentially a technique in which you learn to focus and pay attention to your thoughts without judging them. And you pay attention while you're focusing on these thoughts. You also pay attention to the bodily sensations that you're having. And you do this without judgment. Now, easier said than done, because our brains are always chattering a mile a minute. At least mine is. I'm sure yours is too. So if you want to practice this today, just practice while you're eating a snack after this. Let's say you want to have an orange. You focus your attention on peeling the orange, and then how it spritzes out its essence, and you smell it in the air, and then how it tastes. And notice how your thoughts immediately go to something else. Just pay attention to that. And then just draw your attention back to the orange and just say to yourself, oops, I'm thinking again. I'm thinking. And don't judge yourself. Don't beat yourself up for your mind chattering. That's the first step of mindfulness. And there's many other practices that you can do. And you can just look online, and there's all kinds of guided mindfulness exercises. But what this teaches you is to be aware, to be in the moment. And this is what we really need to do right now during these hard times, is learn how to just be in the moment, not thinking ahead, weeks from now, and all the different chores that we have to do and all the different things we have to do and all the different worries that we have, just being in the moment. The third thing I would recommend is progressive muscle relaxation. And this is where you learn to tense or tighten up a muscle group one at a time, and then you follow that tension by releasing it and feeling relaxed. And most people will start by relaxing one muscle group at a time, starting with their feet, working up to their head. The whole thing can take 10 minutes, and you can find this online also. There's also guided meditation apps online. One of them is Insight Timer, which is free. Another one is Headspace, which gives 10 free sessions. And meditation is a little different from mindfulness, in that mindfulness helps you focus on the present, whereas meditation is more, helps you to sort of clear your mind a little bit. But again, this is all online. You can get yoga classes online, which is very helpful. Journaling, especially gratitude journaling, is very helpful to some people. Aerobic exercise, there's tons of free online classes, and you don't need fancy equipment. You don't need to go to a gym. You could just dance around your house or put an exercise tape on. You could do this with the kids. Go to bed earlier, make a conscious effort to go to bed an hour earlier if you can, even a half hour, because the sleep really affects your brain functioning. I'm sure the doctors will talk more about that. And lastly, take breaks from this 24/7 news cycle about COVID. Turn off your Twitter, turn off Instagram. And when you do consume media, be mindful, pay attention to the time of day that you're doing this and how you're feeling. And if it makes you more anxious, turn it off. Turn it off for an entire day if you can. And let go of too many shoulds. You know, I should be doing this, I should be doing that. Take time to do the things that you really enjoy more, such as if you read, join an online book club, enjoy a good movie on TV. So that's the first thing. Then the second thing is supporting your children's emotional functioning. School's a time where kids learn how to be social and they see their friends at school, they practice their social skills, they build relationships, and they have to repair these relationships when they have a disagreement with another classmate or a teacher. They have to go back to school the next day and work it out. But now these kids are getting school online and they're missing that opportunity. So some things you can do to help them is, especially with your elementary age children, establish a routine time that they can talk with their friends, like on Google Hangouts or FaceTime or Skype. And if phones are the easiest way to connect, I would suggest you keep their phone in another room during their schoolwork, and also charge their phones and your teenagers' phones in your room overnight. Would avoid them staying up really, really late and not getting good sleep, because they need to get good sleep too. You can help your kids stay in touch with their friends by sending old-fashioned mail, which is really fun for children. Help them write a letter or draw a picture and mail it to their friends, and allow them to have some limited time on the computer. But you could schedule that with other parents. This is the set time that they're all going to meet. They're going to play a game together on the computer. And then encourage them to come out of their room and socialize with the family too. And lastly, I would encourage my children to play outdoors as much as possible, but if not possible, indoor breaks throughout the day would be good between their classes. Then you can do that with them. Take a little break to stretch or dance around the house. Lastly, this woman needs more support. She needs to be able to speak with her partner about dividing the household opportunities, because women always share the larger portion of childcare and housework. So I just want to give 3 quick tips for productive discussion versus unproductive arguing. The first one is making I statements. Honey, I'm really stressed right now. I'm really anxious right now. I need help around the house. That's an I statement. Avoid making statements like you always or you never. And thirdly, avoid barbs and digs and sarcasm. Just state what you need from your partner. Ask them to repeat it back to you to make sure that they understand what you're asking for. And then ask them if they can do that. And if you can't get anywhere with that and the argument continues, I would suggest that they seek couples counseling. I want to say as a side note also that during COVID right now, the domestic hotline, domestic violence hotline is reporting that they're getting many more calls about domestic violence. So if the arguing were to escalate, I've provided a number of hotline numbers. At the end of this, you'll be getting an email with some of these resources. You could search for an online support group by Googling parenting support group, childcare support group, or working mother support group. You could also consider hiring a sitter for a few hours a day, but avoid choosing an older relative or somebody with an underlying medical condition. Don't try to be the kid's teacher. Call the teacher if the kids are having difficulty with assignments. And lastly, stay in touch with your supportive family and friends and members of the clergy if that pertains to you.
All great tips for post-COVID even. So let's head over to Dr. Dibble. Do you have anything?
Thank you, Mary. I took lots of notes. I guess hearing this woman's story, her life is stressful pre-pandemic. So this put her over the edge, as it did a lot of people. One thing I would say is just validating and normalizing how she feels. certainly giving her the resources to improve her life. But this is really normal. She's trying to work. She now has her children at home doing virtual learning. Whether your kids are in elementary school or high school, that can be challenging, and especially back in the spring when this was thrown upon us. So I would definitely just normalize how she is feeling. As far as the weight gain, very, very typical, whether it's the COVID-9 or the COVID-19, we see a lot of that. People are not in their normal routines. They're not eating the same. They're not exercising. If people are anxious or depressed, they're not sleeping well. When we don't sleep well, we feel more overwhelmed, and actually that contributes to weight gain. So I think stepping back from just her addressing her mental health issues, her physical health, making sure that she is eating well, exercise, she can incorporate her children into that. They're 6 and 8. They can go for walks, they can go for runs, they can go for bike rides. I think that's actually been a positive with the pandemic. I certainly in my neighborhood see so many more families out together when the weather is nice, of course. So eating well, exercising, sleeping is super key. And then I think if she finds herself in a place where she's feeling so overwhelmed, not able to sleep, that's the time to seek medical help and advice. And again, for some, it's just validation and normalization and providing some support. For other women, it may be medication or adjustment in medication, and also just discussing sleep hygiene. I also want to echo what Mary said about social media. I think what you see is people who took the pandemic and are learning to play a new instrument and are cooking gourmet meals for their families. And for, again, I'll say women, but for women who are seeing that and don't feel that and feel like they're failing, sometimes it's better just to put away the social media.
Okay. How about you, Dr. Patel?
So thank you, Mary and Dr. Dibble. I think they've covered a lot of important things, and agree with Dr. Dibble is this woman is whatever she's feeling is normal. Being a working mom myself and having 3 kids of myself, I can certainly relate with everything she's gone through. So I think it's very normal. I have practiced some of the things that Mary's already recommended, like being mindful. I think that has really helped, and I'm sure it will help a lot of other women out there, is live in the moment. This is not the time to start planning for the future. Things are changing rapidly. We've got to learn to live in the moment. And a few things that the pandemic has taught us, which I think we all will need to accept. I think one thing is learning to accept that things are different. I think once we realize and we accept things are different, we may be able to come with different solutions. So I think acceptance is a huge thing that I would like the community to know, that we are going through a difficult time and we have to accept it's a difficult time. We have to accept the limitations that come with a difficult time and what we can do with what's within our control. We really need to focus on the positives. Things that have helped me personally is resurrecting some of my old hobbies. Like Dr. Dibble said, go on a walk. And that's what I did. I went on an hour-long walk. My kids started riding a bike an hour a day every summer. So you really need to find things that you can do within the limitations this pandemic has put in front of us. And of course, taking care of your health. I think we do indulge in things that are easily available to us when we are in the home. So, it's getting that extra glass of wine or munching a little bit more on the cookies. And that's where I think Mary's advice of being mindful will help a lot of us get through this pandemic. So I think having lived it, I'm sure Dr. Dibble is in the same shoes that I'm in. I'm sure a lot of women out there are in the same shoes. And we've got to accept, focus on our positives, and practice some of the tips that Mary gave us.
Yep, fantastic. I mean, personally picked up some new hobbies. I didn't think I'd start puzzling, but here I am. So thanks, thank you all. Now let's jump to our second profile. This is also a reminder to the audience that we'll do a Q&A at the end, but feel free to put your questions as we go in the Q&A chat. So our second profile is Paula. Paula is what we call the sandwich generation. At 55, she has children in her 20s who are self-sufficient but still need guidance and support. This has been hard now that her elderly mother has moved in with her and her husband after the death of Paula's father. Due to COVID-19, the family was unable to hold a proper funeral and grieve, which has caused Paula much sadness. Her mother in particular is struggling with this. In fear of also losing her mother, Paula has had little to no in-person interaction with her children, and she rarely leaves the house in fear she'll bring the virus home. She has never been a heavy drinker, but due to the stress and anxiety that she's feeling, she found wine has helped put her at ease and is drinking more than she ever has. And she's struggling to care for her mother, husband, and children. Dr. Dibble, where would you like to start with Paula?
So Paula also pre-COVID had a stressful life, being responsible for her children and her parents. So taking care of two generations. So again, the stresses of the pandemic. She lost her father. She is certainly exhibiting signs of abnormal grief. She is isolating herself. She is coping by using alcohol. And lastly, you just have this sense of loss of control. Whereas she could be empowering herself as a caregiver to protect her mother by promoting all the things we've talked about with Dr. Liebers, the physical distancing, the hand washing, the mask wearing. So she, in terms of the cliche of she can't take care of other people unless she takes care of herself. So I'll take this opportunity to introduce telemedicine at this point, because I think my advice for this woman is to really seek out help and support, and that's often done through the primary care physician. So telemedicine, also one of the big positives that has come out of COVID. I think it was probably less than 2 weeks after things started shutting down that we started doing telemedicine visits. So it allows telemedicine, whether it's through video conferencing or telephone calls, allows patients to be in touch with their healthcare providers. So if this patient were to reach out to me, clearly would address her abnormal grief and be able to refer her to people like Mary May that can help her. In addition, in this time of the pandemic, it's going on a long time, so we can't ignore chronic medical illnesses. So the telemedicine allows people to make sure that their diabetes is under control, their hypertension is controlled, preventive care, cancer screening is not being ignored, things like that.
Okay, Dr. Patel?
So I would like to pick on Paula's fear. I think there are many women like Paula who have a lot of fear that has emerged from this pandemic. And this fear has led to some of the population not presenting to the emergency department sometimes for symptoms that could be life-threatening. Someone having a chest pain, someone having weakness in their arms, which could be a sign of something very dangerous like a stroke. Chest pain could be a sign of something dangerous like a heart attack. So I want to let the community know that the emergency departments at Ellis and across the country have taken all precautions to ensure that patients are cared for safely and that they are not exposed to other patients that may have COVID-like symptoms. So please utilize the emergency department in times of true emergencies. It is a safe place to visit if you really have symptoms that need to be evaluated. And again, as Dr. Lieber said, and as Dr. Dibble said, it's very important that at an individual level, we follow the recommendations that have been given to us that will help change the trajectory of this pandemic. It has to be followed at an individual level to be reflected at a community level, which can then be reflected at a national level, which is you've got to do the physical distancing, you've got to do the hand washing, and you've got to wear that mask. I know for many it's question of lives versus livelihood. Unfortunately, they are both not mutually exclusive, and we have to find a middle ground of having a livelihood while saving lives. So, and I can tell you, being in the acute care setting, being in the hospital setting, where we absolutely follow these precautions, where we are very cautious about washing our hands, we are wearing our masks, we really are doing the physical distancing. And despite of being and taking care of COVID patients, the healthcare workers have not contracted COVID from within the hospital, then they are getting it in the community. So these things do work. So I just want that message to be out in the community. So I know there is a fear, but I think we can face this fear by following some of these recommendations so that we can at least get some normalcy to our lives.
So Mary, what recommendations do you have for Paula?
Well, I want to talk a little bit about grief, because grief is really a normal response to not only the loss of life, but also to any drastic life changes or drastic changes to our daily routines, such as you could be grieving over a loss of job, not making enough money. People are missing milestones such as their graduations and weddings and baby showers. And many of us are missing things that we used to love doing, like going to parties and concerts and movies. So grief runs the gamut. And the common grief reactions are shock, disbelief or denial, anxiety, anger, sadness, and loss of sleep and appetite. But also, a lot of people feel guilt when they grieve over losses that seem less important than loss of life. So I just want to put that out there, because I think a lot of us are experiencing that right now. We might not have lost people, and yet we're still grieving over our society, for example, and the way things have changed. So I just want to share some tips about how to cope with grief after the loss of a loved one. And keep in mind, this is for the person who's grieving, but also if you are someone that's supporting the person. So if you've lost someone, it's okay to let people know that you welcome their support and that you welcome their phone calls and conference calls and things of that nature, because sometimes the people who are watching you don't know how to respond. They don't know if they're going to be imposing on you to call you. So let them know that you need their support. Ask family and friends to share stories with you and pictures. They can send you emails, letters about your loved one. You can even coordinate a date or a time with friends and family to honor the loved one. And you could ask each household to recite a poem or a spiritual reading or even a prayer. Other ideas are you can create a virtual memory book or blog or a web page that you can honor the loved one. And you can ask your family and friends to contribute. Another activity that's really helpful in grieving is to do some activity that has significance to you, had significance to you and the deceased person. So like when my mother died, about a year after she died, my husband and I, she was a wonderful cook, wonderful Italian cook. And she made this one dish that you hardly ever see in restaurants or anywhere. It's called spadinis. This is a veal dish. And my husband and I sat down and got her recipe out and made that. And it was so wonderful. I actually cried when I took the first bite because it was brought back all these memories of my mother. So things like that, planting a tree with your family is another activity that some people find really helpful. You can also seek professional grief counseling or mental health services. There are support groups and hotlines that you can call. You can seek spiritual guidance from a faith-based organization if that applies to you. And I would recommend any book written by Alan Wolfelt. That's W-O-L, F as in Frank, E-L-T. And this is on the list that we're going to give you afterwards. But he's written books on understanding your grief. He has one that's a calendar where there's 365 meditations every day to help you heal. He has books on healing the adult child's heart, healing a spouse's grieving heart, healing the adult sibling's grieving heart, and they're really wonderful books. Now, if you're coping with distress from other types of loss or change, it's really important to just acknowledge it and accept it, the way Dr. Patel was saying. Just acceptance is so important, to acknowledge your own feelings as though they're normal, and then find ways to express it. And then lastly, consider if you're grieving all the things that you've lost, like the parties and the movies and all that stuff, then consider developing new rituals to stay connected with loved ones, to replace those other ways. And that can be like people who live together, having a game night, or exercising and cooking together. And focus on the aspects of your life that you have control over now. Again, like Dr. Patel was saying, stay in the present, focus on what you have control over now, and stop worrying about future losses. We can't control whether we're going to lose somebody else. We can only focus on today.
Great, yeah. And as Dr. Patel said the other day, reconnecting with family that you haven't talked to and spoken, that's been a big activity for everyone. So for our next patient, this one is Rosie. She's 75. She lives by herself. And during the spring and summer months of the pandemic, she has kept busy visiting friends and family via Zoom and outdoor settings, taking walks with her neighbors, gardening, and other house projects. But thinking about the dark and cold months ahead and what the upcoming holidays will look like is making her particularly anxious. In the late spring, her beloved older and last surviving brother died from COVID-19, alone in the hospital. Rosie is struggling with the thought that he was alone and that she didn't get the chance to say goodbye. Although she knows she should be grateful for all the good in her life, some mornings she is finding it hard to get out of bed. So Dr. Patel, why don't we start with you on this one?
Thank you, Brooke. So there are a couple of things that really jump out to me on this case. Number one, I would certainly like to commend her for adopting to technology. It's good to know that she's already adopting to technology. She's using Zoom to connect with her families. I know some of the elderly and the older generation had to make this marathon race to get themselves updated with technology so that they could connect with their families. So I really commend her for that. I know that going forward into winters with holidays around the corner, it is going to be challenging. It brings a lot of anxiety. And I'm hoping that some of the tips that Mary and Dr. Dibble gave us will help the families make some changes. As Dr. Lieber said, we will have to find happiness within our families, within our homes, with nuclear families, and find other ways of connecting with people. What jumps out to me, particularly in this case, having worked in an acute care setting, is how her brother died alone in the hospital. That has been challenging for the patients, for the families, as well as the healthcare workers. Again, technology has helped us a lot. We've had special iPads on the floor where we have the COVID patients, the nurses, the doctors, the nurse practitioners, the physical assistants, the techs on the floors have really gone out of their way to be more than just a tech, to be more than just a nurse. They have tried to be their friend. They've tried to be their family. I've had my own colleagues hold patients' hands, especially in those last few days during the peak of the pandemic, when we had these visitor restrictions not allowing anybody in the hospital at all. And the hospital was the family for those patients. So being on the front lines, I would also like to thank the healthcare team for being the healthcare worker as well as the family for those patients. And for the families to know that we did everything we could to make them feel like family. Technology did help us a lot. And hopefully now we've lifted the visitor restrictions. Hopefully we can keep them lifted for the few hours we have. If we follow the three things, we need to physically distance, we need to hand wash, we need to wear masks, so we can continue having the 4 hours of visitors that we are allowing right now. The other thing we found challenging as a healthcare community at the peak of pandemic, it was a new disease. We did not know a lot about the disease. I have to say, 6 months into this, we have a good handle on what we are going to do with COVID patients walking through the emergency department onto the COVID floor. We definitely have a much better handle right now than we had in March and April, when we were at the peak of the pandemic. We didn't know much about it. However, at the peak of the pandemic, and even now, I should say that we still struggle with things like families coming where we've had to have goals of care discussion. We have patients and families who do not have a healthcare proxy assigned. So this would be something that as a community, we could work on seeing if we have a loved one that we could have a healthcare proxy assigned to. And maybe while we are able to think for ourselves, to spend some time thinking about what we would like for ourselves if we were towards that end of life, or we had to make these tough decisions of whether I would want to go on a breathing machine for a short period or a prolonged period, whether I would want to have CPR or not. These were some of the tough decisions we had to take early on in the pandemic, because patients were deteriorating quickly. We didn't know much about the disease then, and we were using mechanical ventilation a lot during the beginning of the pandemic. We're not using that a lot right now, but would certainly wanted to share the lessons we've learned from the beginning of the pandemic.
Mary, would you like to add?
Well, I already talked about grief and loss in the second scenario. So in this one, I like to focus on depression and loneliness as risk factors in senior citizens' health. Even in healthy adults, there was a study in 2015 that was published that showed that loneliness is as dangerous a risk of mortality as smoking 15 cigarettes a day. And we know that depression is the most prevalent mental health condition in the elderly, and it can lead to physical, mental, and social impairment. So with COVID, the typical support networks that the elderly would use, such as activity centers, church groups, government programs, are all unavailable or limited. Although things are getting better, more and more things are virtually available. So the first thing, if she were my patient and we were talking about her depression and her grief, I noticed the word struggling. She's struggling with thoughts that her brother died alone. And I'm emphasizing the word struggle because it's something that we do at times that doesn't get us anywhere. It's the opposite of accepting. And I hope this doesn't sound cold, because I don't mean it to be that way, but I would work with this woman to try to accept what reality was versus what she wishes could have happened. And that, she regrets not being able to say goodbye. It's the same thing. She can't change that, but she can say goodbye now. And so maybe I would help her to figure out, like, maybe she could journal about it, or I'd ask her to write a letter to her brother and read it to me during a session and say goodbye to him and share that with me. And then I would thank her for the privilege of listening to that and thank her for sharing that with me. If she's a spiritual person who believes in the afterlife, then she might say goodbye through prayer. The other thing that I hear about her is that it sounds like she's guilty. She's feeling guilty. She says she should be grateful for her life, but she isn't. That's another thing that's not helpful, the shoulds. Acceptance is crucial here. So, you know, I would try to help her to accept these feelings as normal and help her to accept reality, and then to figure out some way that she could say goodbye and find some closure and some peace. The second thing is loneliness. As Dr. Patel was saying, this woman is really good at, you know, she's embraced technology, she goes for walks. I would encourage her at this point to continue using computers and smartphones even more. And at the end of this, when we send you resources, I've actually included, for those of us who are maybe not so good about learning new technologies, just some links to popular platforms and how to set them up. I would encourage her to exercise more indoors if possible. And even though she's over 65, doesn't mean that she can't go out for walks even in the middle of winter, as long as it's not icy, because fall risks are, of course, a problem with the elderly. But I would say bundle up and go out for walks with your friends. Join online classes, learn something new, like we've been saying this. And then lastly, I want to just tell you about something that I just learned this week. There's something called the Village to Village Network, and I'm really excited about this, and you can look this up online. Villages are, they're networks that are membership driven, and they're nonprofit, and they're run by volunteers and paid staff, and they're all over the country. And in this model, people who join a village can receive help from volunteers who will like go grocery shopping for them, pay them a visit, give them a ride to a doctor, and it's free. It's run by volunteers. They will help the person have access to handymen and women, plumbers, electricians, people who will do work for them at a lower cost, things like that. There's already one that's open in Half Moon, and there's one that's open in Delmar. And then there are two in development, one in Niskayuna and one in Albany. And so it's called the Village to Village Network. If you want to Google that, that's something that's really useful for helping the older population stay in touch with the community.
Wow, sounds like a great program. Why don't we finish off with Dr. Dibble?
So I don't actually think I have too much to add. Mary May and Dr. Patel covered a lot. I think I would just add, again, she's 75. She's actually coped pretty well, staying active, staying connected. Again, not certain what her medical conditions are, just keeping on top of that. I think preventive care, I have to put in a big plug for the flu shot this year. She needs her influenza vaccine. She needs her pneumonia shot if necessary. I have seen people who never get the flu shot are getting the flu shot this year. So I think people are understanding the importance of it this year. Mitigating influenza, keeping people out of the hospital, which the flu shot has shown to do. So that's important. And then lastly, just to, I'm sort of the yin and yang with Dr. Patel of being an outpatient doctor. COVID definitely pushed forward in a good way. This is a positive thing that we should have been doing before the pandemic, talking about what we call advanced care planning. And what that means is every patient, the healthcare proxy, whether you are 21 or 91, you should have a designated healthcare proxy, identifying a person in the event you cannot speak for yourself what your wishes would be. So only in the event that you can't express your own wishes, you should identify a healthcare proxy. That person needs to know who he or she is. And then of course, having some level of discussion about what your wishes are. And often this does not need to be morbid. I know my own parents have a hard time talking about this, but it's really just what's important to you. What is so important to you that you don't want to live without? And then again, with our patients who, not just elderly, but with advanced chronic diseases. So if somebody has end stage COPD, heart failure, then we go on and have some further discussions with those patients as well. Again, which we should have done pre-COVID, is again, just end of life wishes so that we can make the job for doctors like Dr. Patel easier. But these can actually be very enlightening, connecting conversations with patients. And I have actually, again, see this as a big positive from COVID.
Great. Having the conversations people don't want to have. It's hard. Well, thank you everyone for your wonderful insight. We all have someone that can relate to one or all of these scenarios. So audience, if you haven't asked a question yet, now's your chance. We have a couple more minutes. If not, then I will thanks again to all of our panelists. I mean, there's so much more that we could discuss, but unfortunately, we are out of time. This year has been challenging, and COVID-19 has certainly changed the way we live, work, and interact. So I'd like to thank you again for supporting Alice Medicine and for joining us all on Women's Day in the New World. As we want to give a special thank you to our sponsors, Neil and Jane Golub, CBS 6, Blue Shield of Northeastern New York, MVP Healthcare, Overton, Russell, Dorr, and Donovan, Schenectady Hardware and Electric, SEFQ, Freeman's Bridge, Wine and Liquor, Saunders Fine Jewelry, Kingsway Community, and Mohawk Ambulance Service. A reminder to please visit womensdayin.givesmart to bid on our fabulous auction items and to participate in the wine and whiskey poll. The auction in the wine and whiskey poll will be open until Friday at 1 p.m. So bid often and thank you everybody for all that you do. We appreciate it.
Thank you, Brooke.
I think that's a wrap.